Hello, friends. Welcome back. I'm Dr. Harvinder Singh. We know that close to 70 to 90% of reproductive age women have either one or more physical or emotional symptoms during luteal phase of the cycle, and close to 20 to 40% have symptom consistent with premenstrual syndrome, pre-PMS. We'll talk about that more in the course. And close to 8% have symptoms severe enough, interfering with their daily functioning. And that's what PMDD is, premenstrual dysphoric disorder. First is, how do we diagnose PMDD? I will be actually summarizing criteria as mentioned in DSM-5, but I have made some diagrams here to make it more simple for everyone and more easy for everyone to ask these questions from every patient that we suspect having this diagnosis. So, first, how many symptoms are needed? At least 5 symptoms are needed in majority of the menstrual cycles. Now, what time period do we focus on when we ask questions to females? This is the timeline. So, mostly final week before the onset of menses, symptoms should be there, and symptoms should start to improve within a day or two and should not be there within a week post menses. This is a time period that we will focus on with all the symptoms moving forward. Now, what symptoms are we talking about? So DSM-5 actually makes 2 categories here for symptoms. First category symptoms are must. At least one of these symptoms should be present. And then there are some additional symptom categories that may accompany these must category. But what symptoms are included in this must symptom category? So first and most important is marked affective lability. This means a person is having mood swings, feeling suddenly tearful or sad, feeling increased sensitivity to rejection. That's number 1. Number 2 is increased irritability or anger or increased interpersonal conflicts. That's number 2. Number 3 is increased depressed mood, which can be increased feeling of hopelessness or self-negative thoughts. And fourth in this is increased anxiety or tension or feelings of being keyed up or on edge. So these are the 4 symptoms in this class. At least one should be present. More can be present, but at least one of them should be present, not the other way around. And what are the additional symptoms that can be present to make this number total 5 symptoms? In this other class, the first symptom is decreased interest in usual activities like work, hobbies, friends, school. Second symptom here is decreased concentration. This is more subjective symptom. Third is marked lack of energy or feeling lethargy or getting easily fatigued. Fourth symptom here is fluctuation in appetite. That can mean decreased appetite, overeating, or even specific food cravings here. And fifth symptom here is fluctuation in sleep. That can mean insomnia or hypersomnia. And then sixth symptom here is a sense of being overwhelmed or out of control feeling. And last symptom here is physical symptoms. And the physical symptoms most commonly reported are breast pain, tenderness or swelling, muscle or joint pain, sensation of feeling bloated or weight gain here. You must have noticed that most of the symptoms are mood or anxiety symptom, and then in the end we have physical symptoms. We'll talk about the relevance of this in few minutes. So look at this table. We know the timeline that we need to focus on. We know the symptom that we need to ask for and what are the must symptoms here. But there is one more thing we need to ask, which is symptoms are present, but these symptoms should be confirmed by at least 2 prospective cycle. So when a patient comes to you, you suspect PMDD on your first visit, you have to follow this person for at least 2 prospective cycles having these symptoms in next 2 cycles. And we will talk about the process for that. How can we do that? So this is how you diagnose PMDD.